When you click start, just say, hey, I'm Eddie. I'm one of the medical students that's going to take care of you today. How can I help?
Hey, nice to meet you, Eddie. I'm Ben Johnson, and I've been having some really bad abdominal pain for the past 2 days.
I remember when I was going through it, I had no idea what to ask. What do you even ask during a medical interview? What does the interview actually entail? Because I've only done job interviews and med school interviews before. And as we progress through the various things, once you have a framework, now they add in some complications. So now you have to hone your clinical decision-making skills. What does this patient actually have based off the questions you've asked them? And then as we progress further, we get more complex cases that are more realistic of real life. Some of these scenarios we could say pretend as if you were an agitated patient, or pretend you're a patient presenting with XYZ condition. And really, it's a way, all these scenarios are different, and we do have random scenarios. So there is a way to make it a little bit more combative or a little bit more pleasant depending on what type of patient you want to see.
Have you noticed anything that helps your pain get better over the last hour or so?
I tried resting and taking deep breaths, but it didn't seem to make the pain go away. It's been pretty consistent since it started.
The history that you take from a patient is almost 99% of the diagnosis that you make. And the impression that you make on a patient the first time you speak with them is long-lasting and affects their course in hospital and affect their outcomes after hospital. And so I really do think if you have the opportunity to practice, to tailor your questions, to understand how you could have done better, you really do become a better doctor overall, and hopefully you'll be able to help your patients even better in the future. And so I think if I were a medical student when this was around, I think it would have been absolutely one of the most helpful things that we have.
Really, it's a way to gather feedback, to gather ways to see how medical documentation is generated, as well as ways to actually present the patient and communicate it to another team member. So oftentimes, I think students don't really get an opportunity to learn about these types of things until they're actually on the wards. And we think it's a good idea to have more than just a few hours of practice before actually going out and going into the wild and seeing patients for the first time, and really understanding how to generate and communicate important decisions about a person's care.